Hello friends, welcome to my channel Haripriya 2.0. I do hope you're all staying safe, healthy and isolated. I'm back with another episode, and today's episode is going to be an informative session about maternity and childcare during coronavirus. As we all know, coronavirus continues to spread across the globe. Giving birth and taking care of a newborn baby becomes extremely hard during pandemic. So, in this episode, I have invited my friend Rachel Silver from Florida, who is a registered nurse lactation consultant and been into maternity for almost 7 years. Rachel, welcome to the show.
Hi, it's so nice to meet you and so nice to talk to everybody. I'm really excited to be able to share what I know with other moms. I know that it can be a really scary experience right now when you don't know what to expect. So my name is Rachel, for everybody that's watching. I'm so excited that we just have the opportunity to share this experience. So like she said, I'm a mom of two. I'm also a nurse. I work maternity. I also sometimes work in the NICU. I work, sometimes I go over to peds. I'm kind of a jack of all trades, but I just love helping moms, helping new parents. And for those of you who don't know, I also have a website, mommydidyouknow.com. Mary, did you know? But Mommy Did You Know instead, so it's easy to remember and has a lot of great resources.
Rachel, I would like to have this interview more of a question and answer session, and I do have a list of questions that are valuable for new mothers to have answers during this time. So with your permission, I will get started.
That's great. Yeah.
All right, I'm ready with my questions. And my first question is, what is coronavirus and do babies get coronavirus?
So the thing with the coronavirus is that pretty much anybody can get it. It's just the method that they can get it. So basically it's a droplet virus. The way that it works is, let's say you're sneezing or you're coughing, the droplets can spread through the air, and then when they come into your respiratory system, that's how someone can get it. So whether you're a newborn or you're an adult or you're, let's say, a child, you can still technically get it. The thing that we're looking at more is if you can still have the same amount of symptoms. So it's kind of a whole other aspect, is because not many newborns have had it, we're kind of trying to understand how newborns are showing symptoms, and that's something that will come with time. Okay.
Thank you for that, Rachel. My question number 2 is, are symptoms any different between babies versus adults?
So I have been talking to a few of my other doctor friends and nursing friends, and we're wondering, why is it that so many people have the virus but they don't necessarily have the symptoms? And what it really comes down to is their immune response. And what people are finding out is that some people will have the disease but not show symptoms because their immune system is not really attacking it in the same way. So if you kind of have like an overactive immune response, that's how you start getting all of those symptoms very quickly. And that's what's so kind of crazy about this disease, because one person can have it and not even show symptoms and they're perfectly fine, and then someone else can have it and then they end up on ventilators and in ICU. I mean, sometimes it's something like a 30-year-old you think is perfectly healthy, and then the next thing you know, a few days later, they're on a ventilator. And that's really a mystery of this disease right now. So what we are looking more into than anything is their associations with somebody else that has COVID. So let's say a mom comes in and she has COVID, or she starts showing respiratory symptoms. Even if we do not know for sure that she has COVID, we're automatically treating her as if she was positive until she's treated as negative. So even if she comes in and she's sick and she's coughing, we think she might have it, we're going to treat her as if she does have it, to protect the baby and to protect all the staff, and then of course the other patients that we have.
My next question is, what to expect if someone has a baby now?
All right, so if you have the baby now, what you can expect kind of also changes from the hospital, just because some hospitals have different visitation policies. I know that with mine, what we are allowing is we're having one support person that has something called a band. It's a printed band. Every baby when they're born, even before this whole pandemic, would have a band that has a printed number that matches mom and dad, or the support person. So we would have a baby, a mommy, and the support person all have this band with a printed number. And that's also kind of a security measure that we know that this band goes to this mom. So what we are doing in the hospital, and a lot of other hospitals are doing it, is we are only allowing the mom, the baby, because those are our patients, of course, and then one support person that also has the printed band. The only thing is some hospitals are not allowing another support person, but many hospitals are still allowing the support person. It's just one thing to think of the hospital before you come in to see what their policy is, especially because like in our hospital and a lot of other hospitals, what they're doing is if someone comes in to have a baby, they will not be able to leave for the duration of the stay. This is just kind of a way to protect mom, protect baby, as well as the other babies. So then obviously, if you were put in a situation, you would want to bring all of your stuff to the hospital with you. That would last you, at least 3 to 4. Your stay is going to be a lot longer too, because an induction can last, let's say, sometimes it's like 8 hours, 6 hours, and other times it's 24 plus hours. So it depends. If you're coming in and you're not dilated at all, you're obviously probably add on another day to that. Vaginal deliveries usually stay about 48 hours, like 2 days, sometimes less, but it's about 2 days you'll be in the hospital. For C-sections, usually we put 3 days, but we have been discharging people earlier on the second day for C-sections if they want to leave. Of course, it's mom's choice, and it's a wise decision to have a baby in a hospital right now, and of course it's mom's decision as to if she wants to leave earlier, as long as they're okay and they're healthy.
My next question is, are visitors or siblings allowed in the hospital during this time?
Yeah, and then sometimes, I feel bad to say that some people can't visit, like siblings and brothers and sisters, but what some people have
siblings considered as a family.
Yeah, because they can't visit right now. So what some people have been doing is actually kind of having a welcome home party, so like when they come home, they do something special with the child, or they have a toy and they say it's from the baby, this is the baby's toy.
That's sad. That's sad for the little ones to really understand.
But you can also Skype and video message with your child so that they can still see the baby, and you can make those memories that way.
Here comes the important question about breastfeeding. If a mom has coronavirus, can she breastfeed her child?
All right, so right now the CDC recommendation is still to provide breast milk. Breast milk has a lot of great qualities in it, and it's also like an antibiotic. Right now, because COVID is such an early disease, breast milk, they don't really know if it has immunities exactly for the coronavirus, just because it's such a new virus. But breast milk does have a lot of immunities for other complications that coronavirus comes with, such as those respiratory diseases and other things like that, because the breast milk is it's a coating, it's a protective barrier around that baby's gut and that intestines and the stomach and all of that. And what it does is it promotes good bacteria, and it kind of prevents bad bacteria from growing in that baby's body. So it will overall help that baby. Now, if mom's going to be giving direct breast milk or pumping is of course up to mom's decision, and of course it's up to the hospital policy as well. Some hospitals, most hospitals, they still are promoting to give the baby breast milk because it's that powerful. It's golden, it's liquid gold, just like they say. But what a lot of hospitals are doing now is they are promoting pumping. So what a lot of moms are doing, if they do end up positive, is that they're pumping and giving that breast milk to the baby. It's just one thing to think about as well. is that if you are positive for the coronavirus, they probably will not be able to store your breast milk. So, and obviously you're not able to leave. So you would have to give your baby that breast milk like straight as soon as possible, give to the nurse who has your baby. You're either going to be rooming in with your baby, or you are going to be separated. Your baby's going to be in a separate NICU nurse or in a special room, and then you're going to be in another room. That's what a lot of the recommendations are saying, to separate. Or of course, if mom does not want to separate, because I know it's a really hard time, they can always stay in the room together with special precautions, hand washing, masks, things like that.
Thanks, Rachel. That was very helpful. And my next question is, how can a pregnant mom protect herself if someone in the family has coronavirus?
You want to take the same precautions that you would if anybody in your family has COVID, whether you're pregnant or not, because it is a very serious disease and you want to protect yourself. And then of course, if you're pregnant, you want to protect your baby. So definitely number one is hand washing. You want to have good hand hygiene.
Rachel, here is the question about hand washing. We all know that it is important to wash hands frequently, but as a medical professional, please share with us the right way of doing it.
So it's so simple, but a lot of people, they just put the soap and then they put their hand inside the water. But you want to first wash your hand first with the water, with lather, for 30 to 45 seconds. You can sing the happy birthday song, happy birthday to you. That'll really help you out. And then you want to turn off the sink too. You want to, you can take a paper towel, whatever you're using, and you can use that to close the sink. And then of course, whatever doorknobs you're using, if you're coming out of a bathroom, you can hold that paper towel, use it to open the doorknob as well.
Here is my next question about COVID testing. Are pregnant women tested differently for coronavirus?
All right, so basically, if you come in and you think you might have the coronavirus, they're going to put you on something called isolation precautions. Basically, even if you don't know if you're positive, let's say you come in and you're sneezing and you're coughing and you think you might have it, you would expect them to come in with masks and gowns and the whole head covering and everything. They will probably swab you for the flu. They will probably swab you for the coronavirus as well. And actually, a lot of hospitals have a rapid test. Before, it was taking a long time that we wouldn't even know if a patient had it or not until after they were discharged. But now they're actually coming pretty rapid, like 24 to 48 hours. So it's really making a big difference, especially when it comes to a lot of negatives. Because let's say you're a mom, you come and you think you have it, at least we can find out if you have it or not before the baby is born.
This is a question about hospital birth versus home birth. Given the current situation, some mothers might be considering home birth rather than hospital birth. I know it is the mother's choice at the end of the day, but Rachel, what is your recommendation?
Right. Well, I love what you were saying, that it is the mother's choice, because in the end, everything's the mom's choice. But me as a nurse, my role is to educate moms so that they can make informed decisions, because I want you to be informed and educated. So the thing is, you're also talking to someone who works in the hospital, who's seen a lot of things go wrong. So for me, I would always prefer a hospital birth, just because there are a lot of things that can go wrong, especially in the times that we're living now, where let's say you have someone that seems healthy and then a few days later they start deteriorating really fast. And the thing is, if you were at home, sometimes you wouldn't pick up on those symptoms fast enough. And when you're in the hospital, you're being observed, you're being measured and recorded, and people are really looking into those symptoms to have fast treatments. So sometimes it's something as simple as being able to intervene fast. Offices and OB's offices are not really seeing patients that much unless it's for emergencies. So then sometimes there are exams that we would be doing in the hospital that they would not be doing necessarily in the home. So you can miss out on a lot of newborn testing and mom testing that would have caught stuff way faster, even as something as simple as a jaundice screen. Because if your bilirubin gets up too fast, it can be devastating for that baby. So if you're waiting too long, you can you can hypothetically miss out on some really important treatments.
Here is the question about isolation after baby is born. How can moms quarantine safely when the child may need a lot of supervision and a lot of visits to the pediatrician?
Okay, so basically when you are home, if you were to have the coronavirus and your baby was negative, usually what we'll do is we'll discharge to a home that does not have COVID, just in an attempt to protect our baby. So for example, let's say you have an aunt that is healthy and hasn't had any symptoms, we would probably discharge them to them until you start getting better and everything's okay in your house. Then for your visits, it really depends on the doctor. Some doctors will still want to see you 2 days. You'll definitely have to go to that visit like 2 to 3 days after you're discharged. But what you can do is pediatricians' offices. And actually, one thing to realize is that a lot of offices are not seeing that many patients right now. So at least you can go there in a time where there might not be anyone there besides you. And a lot of offices have been very careful to make sure that everything's sterilized and everything's clean, because they do want people to get the care, especially with newborns. You know, you want to be able to see the doctor, you want to be able to be seen, because there's so much that can happen in that first week.
So new moms might have a lot of questions about the baby, and if you're not going to hospital that frequently, what is the best way to get connected or to stay connected with the medical professionals?
Of course. Well, one thing that has really been rising a lot lately is telehealth. I know that a lot of people have been talking about it lately, but basically a lot of doctors' offices, even me, I have not been seeing patients in the home for quite some time. Instead, we've been doing online visits, and your pediatrician's offices, OB's offices, even lactation counselors, everything. They're all seeing patients online, and I've been doing it through the phone. Sometimes it's really simple, like someone has a question, they're engorged, or they have a question about pumping or going back to work. It's something really fast over the phone or Skype or Zoom. You know, there's so many different conferences, conference calls, apps that people can use.
So Rachel, what are the most trusted websites for information, especially given the age where there is a lot of information out there? Could you recommend us any trusted sources of information?
So I think we pretty much covered everything. It's just a matter of making sure that mom's staying healthy and safe, that baby's staying healthy and safe. And yes, you can breastfeed. The coronavirus has not been found in breast milk as of yet, but you can always check the CDC for the most recent recommendations that they have, because as you know, this is a rapidly evolving disease. So it's very important to stay informed. The CDC's website has a million things about everything from pregnancy to breastfeeding to postpartum, even in the hospital, what we should be doing as nurses and what to expect as a patient. So it's very, very important to just keep up on that, you know? And then of course, I do have my website as well that has a lot of it.
Let's talk about your blog, mommydidyouknow.com. Tell us how it started and what kind of information you have on it. Of course, I have visited your website, but I would like to hear from your words on your journey.
I was not expecting my website to grow as fast as it has, but I'm amazed, just because it really is something that's so important. I actually just started about not even 4 months ago, because I wanted to have a platform for my private practice as a lactation counselor. So I'm like, okay, let me make a website. So then I made a website, and people were saying, oh, you know, as a lactation counselor, you should have a blog, you should have some articles. It would be nice to, because people have a lot of questions, you know. So
you always want to listen from a professional, and you have a lot to offer from your experience and from your profession.
Exactly.
That's great.
Exactly. And so I got really excited. I started writing down all my ideas. I feel that I still have so many ideas I still want to write about. So I wrote those, and then I started making some free classes as well, like breastfeeding classes, prenatal classes. Those have been growing, especially because it's so important to get good information that's correct. I even put a safe baby class in there, just because a lot of people don't realize sudden infant death syndrome and other ways to keep your baby safe. So I put those in there, and actually just now, I actually just launched my first premium course as well. That's a 2-week kind of overall encompassing comprehensive course that goes over breastfeeding, bottle feeding, goes over pumping, everything about feeding. And then of course I have all the videos that supplement all my lessons, because all of my lessons have a little video that go with it. So I have that on my YouTube.
All right, that is the end of our session, Rachel. Thank you so much for sharing your knowledge on these topics, and I do recommend all the new moms to check out your website for more information on maternity and postpartum care. I do appreciate your time and talking about this, and I hope some new moms out there will benefit from our question and answer session.
Awesome. Thank you so much for this opportunity to speak with you and just get everything out there.
So friends, this is the end of our episode, and if you have found this information helpful, please leave us a note below and share with your friends and family who might be having a new baby. See you all in another episode. Until then, take care. Signing off, Haripriya.